You know that feeling when you're standing in front of a wall of medical equipment options and you're just trying not to waste money on something that will end up gathering dust? You've probably heard the buzz about automatic autoclaves promising one-touch sterilization, but the reality is you still have to wonder if it will fit your workflow, keep your instruments dry, and actually survive daily use without becoming a costly headache. Link is in the description if you want to check the product details on Amazon. Let's break down whether the Tuttnauer USA EZ10 automatic medical autoclave lives up to the hype for a small to medium practice that needs reliable, quick cycles without the fuss of a full-size unit. First off, the EZ10 is positioned as a compact, 10 by 19-inch chamber that claims to finish an unwrapped cycle in 14 to 30 minutes. For a dentist office, a podiatry clinic, or a small veterinary practice that only needs to process a handful of trays at a time, that cycle window is actually pretty meaningful. You're not looking at an hour-plus sterilization time that ties up the room while you scramble to keep patients moving. In my experience talking with a few clinic managers, the biggest pain point is the gap between when an instrument is taken out of use and when it's ready again. A 14-minute turnaround can shave off enough downtime that you can keep a single instrument set rotating through multiple patients in a busy morning without having to double stock. The one-touch operation is another selling point. The EZ10's control panel is deliberately minimal, just a power button, a start cycle, and a few status LEDs. You load the instruments, close the door, press start, and the machine handles the rest. That simplicity cuts down on operator error, which is a real concern in environments where you have rotating staff and students. No one wants a partially closed door or a forgotten temperature setting that compromises sterility. The device's door actually stays locked for the entire cycle, so there's no risk of someone accidentally opening it mid-process. For a practice that trains new technicians, that safety lock is a genuine peace-of-mind feature. Now let's talk about the closed-door active drying system. Most autoclaves will leave you with wet trays that need extra time on a separate dryer or a manual wipe-down. The EZ10 integrates drying into the cycle, which means once the pressure and temperature phases are complete, the chamber actively draws moisture out while the door stays sealed. In a real-world scenario, that translates to instruments being ready to use straight out of the autoclave, no extra handling required. A dental hygienist I spoke with mentioned that the reduction in post-cycle handling saved her a few minutes per patient, which adds up over a day of appointments. But the EZ10 isn't a magic bullet, and the 3.3-star average rating hints at a mixed reception. One practical limitation is the chamber size. The 10 by 19-inch footprint is great for saving space, yet it caps the volume you can sterilize at any one time. If you run a medium-sized clinic that routinely needs to process large instrument sets, think surgical trays with multiple components, you'll quickly find yourself queuing cycles or investing in a second unit. That's a hidden trade-off. The compact size saves floor space but can become a bottleneck if your throughput needs outgrow it. Another nuance is the cycle time variability. The specs list a range of 14 to 30 minutes, and the actual time depends on load size and whether the items are wrapped or unwrapped. In practice, you'll see the shorter end of that range when you're only running a couple of small trays, but as soon as you push the chamber to its limit, you're looking at the longer end. That's not a deal breaker, but it does mean you need to plan your schedule around the longer cycles if you're trying to keep a steady flow of sterilized tools. Reliability is something you can't fully gauge from a spec sheet, but the fact that the door stays locked throughout the entire cycle is a design choice aimed at maintaining sterility. In a busy setting, accidental door opening is a common failure point for cheaper models, leading to compromised cycles and wasted instruments. The EZ10's door stay closed feature reduces that risk. However, because the unit is fully automatic, you lose the ability to intervene mid-cycle if you notice something amiss. Some technicians prefer a manual vent or the option to pause, especially when they suspect an instrument might be out of place. The EZ10 doesn't offer that flexibility, so if you need that level of control, you might look elsewhere. Who should actually consider buying this autoclave? If you run a practice that processes relatively low volumes, think a dental office with 2 operatories, a podiatry clinic, a small wound care center, or a veterinary practice that handles a handful of surgical tools per day, the EZ10 hits a sweet spot. It gives you rapid cycles, built-in drying, and a user-friendly interface without demanding a large floor area or a massive upfront budget. It's also a solid entry point for facilities that are upgrading from a manual pressure cooker or a basic tabletop unit.